Hi.
Hey guys, it's Dr. Emer. We're now doing the harder portion of the treatment, which is our CO2 laser. Everybody has different levels of pain. She has a little bit, but we're managing by doing section by section use of the numbing. She has nerve block. She's being really strong. And you guys can see we're being really thorough. In the areas where she has less scarring, we do a little more spacing, a little more fractionation, and then in the areas where she has a little more scarring, we do a little more overlap. We're working our way into the numbing so that we can keep her in as most comfortable as we possibly can. Our goal is as much improvement as we can get because we really want to get those scars to be much less noticeable.
So we're saying the best doctor.
Trying our best, you guys, as always. Thank you.
The best.
She's doing really well. We're being really careful and cautious with her, being very meticulous because she has super deep ice pick and boxcar scars, so it's really important to do a nice overlap. Okay, good. So now we're gonna wipe. Let's half that, and I'll show you guys really quickly what I mean. So we've done some TCA cross. You guys could see those there. We're gonna do a little section at a time. So again, we just wiped that one section, so we're gonna come across. And we're gonna do a little more overlap in this area. This is where she has the deepest scars. We have a month before we need her to look perfect. Healing shouldn't be longer than a week and another week of redness.
Tell me about what we're going to do after the CO2.
After the CO2, guys, it's really important to have post-care. We're going to apply our intense hydration mask, which has a lot of healing properties to it. Not only does it have hyaluronic acid for skin plumping, and we have tea tree oil in there to prevent any bacterial infections, peptides to help her heal, vitamin C and other botanicals for antioxidant effect to help her heal. So it's all designed to make her feel cool, and to help the healing process. So we're going to apply that immediately afterwards and use PRP that we put on right afterwards underneath to stimulate the healing process.
People want to know, is she awake? Yes, she's awake. People want to know our settings. Dr. Emer's not going to give you his settings. If you look at the pulses, you can tell we're at a very strong setting.
Yeah, you could see the yellow within the scarring areas.
Hello from Cambodia.
Wow.
People from all over.
Go ahead and wipe. So now he's going to wipe off a little bit more so we can finish in sections.
Do you ever use PRF versus PRP?
Not for this. It's not going to be that valuable. And to be honest, I actually don't even think it will go to. I don't even think that it helps. I don't even think it helps darkness. I think PRF does very little, you guys, in my opinion. But it could help the healing process a little bit. We like our stem cells and our exosomes. Find that is going to give a lot more of an improvement in terms of healing, especially after a very strong laser like this.
Is this CO2 or Halo? Guys, this is our CO2 laser. How much to tighten the face up? It depends on how much laxity you have. Will depend on the treatment that we recommend for you and based on your goals as well. Best thing to do is send us a DM, full name, email, phone number. We'll reach out to you. Hi, doctor, you are the best.
You're basically done.
How much for this procedure? Depends what we do in combination with. There's several different variables depending on the areas. Are we doing spot? What are we combining it with? Send us a DM. We're happy to reach out to you and get you all the information you need. What is your favorite brand of exosomes?
Well, we have a mix of ones that we use for various reasons, but our two favorites right now are the Anti-Age and the Benev.
Since I'm in New York, we'll be there next month. Right now we're in sunny Florida.
Okay, so now let's get her nose.
How long does this take to recover?
This will be about a week, 7 to 10 days, and then she'll have some pinkness afterwards and some light sensitivity that will slowly go away over the next week. Good. Now we're going to blend her nose. Not a lot of scars here, but there's always pores that we want to treat. And to keep the skin really even throughout the entire face, you always have to treat every cosmetic unit. So doctors that follow, you guys know there's different cosmetic units.
Those
so
are the doctors asking us questions.
Very important to blend. That's why I don't treat one area alone with CO2. I don't think it can look as good on the face. And so you always have to blend the units. We'll turn you a little here, almost done. And then our next part is we're gonna microneedle a little bit with PRP. That's very minimal pain at all. That's gonna help her heal much more quickly.
And then after that, she's gonna sit for about 10 to 15 minutes with our Emer Skin Hydration Mask. This is the best procedure for skin texture and irregularities.
Well, usually if you're the right candidate, we'd have to see to know if that's for sure for you.
I had PDO threads. Can I see you for laser without melting them? Yes,
yeah,
guys.
we can do it at the same day.
We do that very frequently. We'll do threads, and then we'll do laser right after. No problems at all.
Good job. Almost done. Okay, let me just take a look at everything. I just want to make sure. Do a little side firing here. A couple of her very deep scars. Here a little bit. Sorry, honey. Sorry. I'm just finding little spots.
I know.
You're okay.
Sorry.
You're good. You're good. Everything's done. Just want to take a look and make sure I didn't miss anything. Okay, perfect. So now we're gonna do. Keep your eyes closed.
We'll see you guys in March. We're excited to see you.
We're gonna do the healing protocol. Me too.
That's one of our patients who just did a big laser treatment in New York. We filmed him.
Excellent. We can't wait. So now let's get that. Let's get the hydration mask so I can put a little serum on from there. So I'm going to put a little hyaluronic acid on right now.
Sure.
So you're going to feel a little cool from this, okay? Good.
What does she feel like right now?
Really hot. And has a little bit of pain. So you see the intense hydration mask. We're going to apply this after we do the PRP. But I want to show you guys really quickly. Inside, and I think this is really important. Hold on. Is we put a little bit of this serum on. So this serum will cool her down before we put the PRP on. This will help her heal. So this should feel a little bit cool. Does it feel cool?
Mm-hmm.
Okay, good. And this will help. Sometimes it gets in your mouth and your ears and stuff, so I'll wipe it, don't worry. Again, we're gonna put a little bit more of that serum out. It's okay, I can hold it on here, on the chucks. Okay. We're gonna keep this here for a
the
second.
Eclipse Evo.
Yep.
Our micropen right there.
Okay, go ahead. So now we're gonna add the PRP on, and this shouldn't really hurt much. You'll feel a little bit, but the goal with this is not to puncture too much. We want to get the PRP, the stem cells from the mask, and the hyaluronic acid into the skin through the char of the CO2. So you don't want to be too aggressive. This is not the time to be doing scar type microneedling. Okay. And then he's going to get the rest of the PRP on. And again, we're going to put our intense hydration mask on so we cool her down. And it allows the PRP to penetrate into the skin much more readily. So this makes her feel a lot more cool. It helps her heal. We got her through it. Good job.
You did it. Apply our mask.
Okay, so we're going to apply the mask. Does that feel a little cool?
Mm-hmm.
Good. And then that's it. And we'll follow her as she heals. Our goal is, I'm hoping in this one treatment, we get at least 20-30% improvement. And then from there, we continue with doing more of the same treatment plus some punch excisions if needed. All right, you guys, that is CO2 resurfacing for acne scar combination. Take care. Good.